When you find out that you're pregnant, you know one thing is inevitable that's going to happen to your body, and that's going to be you're going to gain weight, right? But are there some do's and don'ts when it comes to that? Our pregnancy expert, Judith Schuler, gives us the skinny. See what I did there?
Oh,
you see what I did there?
Yes, that's so cute.
I have a lot of questions I want to ask. Some I'm sure are myths and some are not, but what should we really know about weight gain?
Well, let's look at it in a historic perspective. When people got pregnant in the 1940s and 50s, even into the 1970s, weight gain was very restricted. My mother was only allowed to gain 13 pounds with me.
13?
13 pounds.
Goodness.
Well, we know today that that's not healthy for mom and baby. So the good news is we want women to gain weight during pregnancy. The bad news is you have to control it.
Right.
And your doctor will set your weight gain guidelines for you.
So there's not some like
There's
random number we should all be using?
No magic number saying, okay, everybody should gain this or
Yeah.
that. Depends on a lot of different factors.
Okay, and so when you're talking about controlling, I know pregnant women are going, have you seen my cravings? So how do you control it?
You just have to stop and say, I can't eat that.
Yeah.
Let's look at how it affects the baby.
Yeah.
You know, if you gain too much weight, first of all, you're going to do some bad things for yourself. You're going to have more backaches, you might have heartburn, you're going to have more issues with joints. If you gain too much weight, baby also gains some of that weight. So the more weight you gain, the greater your chance of having something like a cesarean delivery. The American College of Obstetricians and Gynecologists now state if your baby is 9.5 pounds, if they can estimate that it's going to be 9.5 pounds or more, C-section immediately.
Interesting, but it wasn't always that way.
No. The many people have given birth to babies who are bigger than 9.5 pounds.
Bigger babies.
Yes.
And this is not on the sheet of anything I'm supposed to ask you, but I was just curious, is having a boy or a girl, does that make a difference in your weight gain? Because I hear that all the time.
No. Boys.
I was just curious.
Well, here's one thing. Let's talk about how much you actually gain.
Right.
When you are given your weight gain guidelines, it depends on whether your weight before pregnancy, whether you're underweight, normal weight, overweight, obese, or morbidly obese. So if you're normal weight, we usually say 25 to 35 pounds. Okay. Now, if you're tiny boned, you know, like a small boned person, or if you're under 5'2", you should gain at the lower end of that because other than that, it's going to be difficult to take off. Here's how it breaks down. That normal weight woman who gains 30 pounds, about 7.5 pounds would be baby.
Okay.
Okay. Then you've got the placenta, you've got the uterus, you've got the amniotic fluid, you've got fluid your body retains. That's 9.5 pounds.
Okay.
So that's a total of 17. Of that 30, what's that other 13?
Right.
It's fat and muscle, and it's not that much muscle. So after you have your baby, you can say, well, you'll probably lose 7.5 pounds immediately because of the weight of the baby. But that other 9.5 pounds, it's going to take some time to get some of that fluid out of your body and your uterus to go back to its normal shape. So, but you're still going to be left with some of that extra weight, and that is gained so that you can get through right after pregnancy with some energy. You know, hopefully your body will convert the fat to energy.
Well, it's so interesting to hear how everything changes and the new information that's coming out and what we're doing. And we always tackle different subjects when you're here, but I know we even tackle more in your book, and I'm going to tell everyone how to get their hands on that. But Judith, thank you so much.
Well, thank you, Tina.
You guys, to learn more about your pregnancy, make sure to check out Judith's series of books. For more information, just visit yourpregnancybook.com.